Okay, good evening, everybody. This time it is Monday, August 14th, 2023 at 7 p.m. and we are meeting at Liberty Middle School. I'd like to call this meeting to order at this time. Welcome to all of you in attendance and thank you for being here. We appreciate your interest and involvement in Cherry Creek Schools. Thank you, Mr. Doherty and Liberty for hosting us this evening. And thank you again for our setup and our teardown crew, our IT staff and security. And I'm not sure if we have law enforcement here or not yet tonight, but thank you for all of you for helping to keep everyone safe. At this time, if you are able, will you please stand and join me in reciting the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America. And to the indivisible, justice for all. Thank you. At this time, Ms. McDonald, would you please read the land acknowledgement?
On behalf of this board and the Cherry Creek School District, I would like to acknowledge that this meeting is being held on the ancestral and unceded lands of the Cheyenne, Arapaho, Ute, and Ochechewi Shakowee people who stewarded for generations. The Ochechi and Shakowee include 7 bands, so I would also like to recognize that over 40 additional tribal nations likely use this area for trade ceremonies and social gatherings.
Thank you, Ms. McDonald. All right, at this time, may I have a motion to approve the agenda for the August 14th, 2023 regular Board of Education meeting?
I move to approve the agenda for the August 14th, 2023 regular Board of Education meeting.
Thank you. Is there a second?
Second.
Is there any discussion? May I have the roll call, please?
Directors Allen. Aye. Bates.
Aye.
Egan. Garland. McDonald.
Aye.
Thank you. That motion is approved. May I have an approval for the minutes, a motion to approve the minutes of the June 12th, 2023 regular Board of Education meeting?
I move to approve the minutes for the June 12th, 2023 regular Board of Education meeting.
Thank you. Is there a second?
Second.
Is there any discussion? May I have the roll call, please?
Directors Allen. Aye. Bates.
Aye.
Egan. Garland. McDonald.
Thank you. That motion passes as well. And finally, may I have a motion to approve the minutes for the August 2nd, 2023 special Board of Education meeting?
I move to approve the minutes for the August 2nd, 2023 special Board of Education meeting.
Thank you. Is there a second?
Second.
Thank you. Any discussion? Roll call, please.
Directors Allen. Aye. Bates.
Aye.
Egan. Garland. McDonald.
Aye. Thank you. The minutes are approved. All right. It's at this time that we leave time for our individual comments from our Board of Education. Director McDonald, will you please begin this evening?
Thank you, Mrs. Bates, and good evening, everyone. I'd like to thank our hosts this evening and all those that make our time here at Liberty convenient and safe. Welcome to everyone. The way my granddaughter expressed it the other evening to me, I'd like to share it with you. She said, I went to sleep at the end of May and I woke up and it's August 14th. So it seems like we're ready for another school year. And whether or not our students are ready, I'm sure our parents are. As you all know, the 2023 election is up on us. There are 3 seats available, mine being one of them. However, I have had the great pleasure of serving with 4 awesome women. As you all know, Mrs. Garland and Mrs. Egan are running for re-election. I believe the continuity of this board is pivotal. I applaud these two women for their strength, commitment, and willingness to want to continue to serve our students. They both are great advocates for the students in Cherry Creek School District. It is my pleasure to support their reelection. As I forestated, my seat is open as well for election due to term limitations. Therefore, I'd like to endorse someone that I feel has the passion, experience, and knowledge to be an effective board member to represent all, and I emphasize all, students in Cherry Creek School District. She especially brings awareness to our community in the Overland Feeder area. She has stated, and I will say proven, that she is committed to fostering an inclusive, innovative, and supportive learning environment for all students. I have witnessed firsthand her commitment and involvement in our community. Therefore, I recommend Mrs. Ruthie Knowles as she campaigns and runs for the Cherry Creek School Board District B. I have every confidence when asked, and when she is asked, how are the children? She will respond, the children are well. This concludes my comments. Thank you.
Thank you, Director McDonald. Director Allen, if you go next, please.
Thank you, Mrs. Bates. Good evening and welcome. Thank you to Principal Doherty and Liberty Middle School and our security and setup teams for making this meeting possible. As a member of the Cherry Creek School District Board of Education, we appreciate the continued interest and support of our families and community members in Cherry Creek schools. With about 53,000 students and 9,000 staff members across 67 schools, we recognize and appreciate the responsibility we have to inspire every student to think, to learn, to achieve, and to care. We believe Cherry Creek Schools has the ability to establish a strong foundation for each and every student that will ensure they have the skills necessary to be successful in school and in life. We build this foundation through our teachers and educators. 91% of Cherry Creek's general fund is invested in people: teachers, nurses, food workers, bus drivers, and more. Less than 2% goes towards the central administration personnel. According to the Colorado Department of Education, our district was ranked the top school district in the state for teacher satisfaction, including high pay and low turnover rate. Since the 2019-2020 school year, our district has reduced the exit rate of educators of color in their first 3 years of teaching from 21.1% to 9.1%. 82% of our teachers have at least one advanced degree. Our district offers one of the most competitive salary schedules for teachers in the metro region, with the second highest salary. For all new teachers and competitive pay and benefits for the more experienced teachers. Our district continues to support its foundation, our teachers and educators, despite underfunding by our state government. In 2022, Colorado spent $3,087 less per pupil than the national average. I thank our teachers, educators, healthcare professionals, and all of our employees for your tireless dedication to all of our kids. I wish everyone a successful start to the 2022-2023 school year. Thank you.
Thank you, Director Allen. Director Egan, you go next, please.
Thank you, Ms. Bates, and thank you to everyone for being here tonight. We appreciate Liberty Middle School and Principal Doherty for hosting us here. I'm very fortunate in this school district to have their safety, security, and setup teams that we do. Welcome to the 2023-2024 school year. The excitement in our buildings is real. In fact, the excitement really began at the new educator training 2 weeks ago, where we welcomed over 460 new educators to the Cherry Creek School District. Our teachers are passionate, highly qualified, and dedicated professionals who are an integral part of Cherry Creek's excellence. We support our teachers and will continue to make CCSD the best place to teach and grow as an educator. I'd like to share just a few of the many things that make Cherry Creek Schools the special place it is. As Ms. Allen said, CCSD was ranked the #1 school district in the state for teacher satisfaction based on a review of CDE's data on teacher salary and teacher turnover rate. CCSD offers one of the most competitive salary schedules for teachers in the metro region, with the second highest salary for new teachers. 82% of CCSD teachers have at least one advanced degree, and since the 2019-2020 school year, CCSD has reduced the exit rate of educators of color in their first 3 years of teaching from 21.1% to 9.1%. Please take time to thank an educator that has made a difference in your life or your child's life as we begin this new school year. Tonight, you'll hear a student health presentation from Ms. Michelle Weinraub. Ms. Weinraub and her team are committed to the whole well-being of our students and staff, and her team, including the expansion of Hazel Health to providing 8 telehealth appointments at no charge to all Cherry Creek Schools students this year, kindergarten through grade 12. This service is available regardless of ability to pay and/or insurance status, and it helps families with access to care and normalizing mental health care as just health care, which it is. All Cherry Creek School District mental health staff, nurses, and counselors have been trained in how to help families access Hazel Health. Congratulations to the Cherry Creek Schools communication team for winning national and state recognition for keeping students, parents, and community members informed about the issues in our district. Also, congratulations to Ms. Marty Benham, who was inducted into the National Speech and Debate Association's Hall of Fame, and Aaliyah Paris and Emily Chang, recent graduates of Cherry Creek High School. They were awarded first and second place, respectively, in the 2023 Congressional Art Competition for the 6th Congressional District. I wish you a wonderful beginning to the 2023-24 school year, and this concludes my comments.
Thank you, Director Egan. Director Garland, please.
Thank you. Thank you, Mrs. Bates. Happy first day of school to everybody. Then thank you to the Liberty Middle School community for hosting us this evening. For the first time in many years, I had a very chill summer. My family and I had the opportunity to visit several of our nation's best interactive classrooms, our national parks. Our national parks and museums always provide affordable, engaging, hands-on experiences for students and families. The Cherry Creek Schools Foundation is excited to offer educator initiative grants again to CCSD educators that work directly with students. Last year, they gave $193,000 to 202 educators at 54 schools, the most in the foundation's history. These grants positively impact 43,000 students. Educators are encouraged to visit ccsdfoundation.org for more information on grants, and the deadline for applications is September 17th. Last year, the foundation supported students with $1 million in classroom grants, mental health programs, and emergency relief, providing $63,000 to families in crisis. We are excited to continue supporting students this year and make an even greater impact. Over the course of this summer, I was also invited to multiple community forums around many issues facing our community. Topics included homelessness, housing affordability, youth leadership, life after high school, and youth violence. Some sessions were led by young people, while others were led by professionals in their field. One interesting takeaway was the information on youth violence. The speaker encouraged the audience to view both youth suicide and homicide through the same lens. Youth homicides are mental health issues turned outward, while suicide is mental health issues turned inward. Let us remember to support all students so that they know that they matter and they are all important to us. It has been my honor to serve our district and our families. I do not take my public service for granted. I've been an advocate for all students, regardless of where they live or how they learn. I believe in excellence for all, and that manifests itself in the many opportunities offered through our district. My colleagues have highlighted many of the reasons I want to continue to serve the students, families, and staff of this district. I'm looking forward to your support this year's election. Thank you.
Thank you, Mrs. Garland. All right, good evening and once again, and thank you for joining us. We are so excited to be starting another school year. Last year, we welcomed back our amazing educators, staff of educators, and we are so thankful for their dedication to our students. This week, we welcome back our students. In Cherry Creek, we use a phase-in approach, so those that need more time or less crowded hallways can comfortably adjust to their new surroundings. Today, our 6th and 9th graders had their buildings to themselves, making it easier for them to find their classes and get acclimated. Tomorrow, our youngest elementary students will have a less crowded building as well, as the 3rd to 5th graders started today. And finally, Wednesday, all students will be back in school. It was a great morning today, welcoming students back as they arrived to Pine Ridge Elementary School. The students were so excited to see their friends and their teachers that I saw many parents who were left behind, standing there just waiting as our children went over to greet their friends and ran to their classrooms to see their teachers. One of the funniest sights was that when everybody was back inside, there was a bicycle just left in the middle of the sidewalk where somebody obviously had gone to class and forgot their bicycle. So they obviously were very excited to be back to school today. And this reminds me of the importance of building relationships with our students and our families. When students are excited to come to school, they thrive. That reminds me then to be kind, show your compassion, and help where help is needed. So our kids are watching. And that concludes my comments for the evening. Mr. Smith, we do not have students this evening because it is the first day of school. So if you would go ahead and give your comments, that would be great. Thank you.
Thank you, Ms. Bates. It's always good when I don't have to follow the kids. So I appreciate that. I just want to say welcome back. First day of school. It was an exciting day. I had the opportunity to get up early, visit our schools, see our smiling teachers, and most importantly, see our smiling kids come back to school. It was just a wonderful day, one of the best days of the school year. A couple of things I want to highlight, though. I want to echo the conversation about meeting our 462 new educators a week and a half ago. The excitement in that room was contagious. How excited they were to be part of the Cherry Creek School District and be part of our family. We had an individual who came from out of state to speak to our teachers about culture and what culture means. And he was blown away by how happy, how excited, how collegial, and how friendly all of us were. And I think that is telling to the Cherry Creek Schools community and the culture that we build within it. I'd also like to thank our teachers union, our association, for our new salary schedule. We wouldn't have had 462 new teachers if it wasn't for that. And I know that took a lot of effort and a lot of compromise between both sides. But the one thing that I want to compliment the most is the dedication of our teachers, because not every teacher got the same raise. Many of our teachers took less money in order to have our new teachers get more. Once again, that's gratitude and my thanks to our teachers for doing that. I will tell you, at my leadership conference, I had superintendents from all across the state say, "How did you do that? How did that happen?" And I said, it's because we have a good relationship with our union and we care about our teachers and they care about our kids. And so I thank them for making those compromises for our students. We also have the opportunity to open our first mental health facility school, Traverse Academy. And I know I got that wrong, Tony. I'm not supposed to say certain ways, but I'm excited for this opportunity for our kids and the partnership with CU Anschutz, the only one of its kind across this country. Once again, Cherry Creek is leading the way. And then we are in initial conversations about our Summer Leadership Academy becoming year-long, partnering with the city of Aurora, having resources for our families, and as Ms. Garland talked about youth violence, what are we doing for our community and our students who get stuck into situations that they really don't know how to get out of. And I'm excited that the city of Aurora has leaned in. I'm looking forward to the partnership with Aurora Public Schools in this endeavor. And once again, Cherry Creek is leading the way. And lastly, I had the opportunity to take my son off to college. And so as I left him in San Francisco and got on the plane and had the opportunity to reflect, I realized weirdly, it had all come full circle. It was almost like I was dropping him off at kindergarten again. The difference was I was going home and he was staying. I wasn't going to be there for that opportunity to give him a hug and ask him how his day went. So I needed to believe that the teachers and the community members that he interacted with instilled in him a sense of self-worth, and that he was going to be okay. And that's a community that does that. Our teachers do that. Our staff does that. And I was confident when I left that he's going to do great things. And here's what I know about the Cherry Creek School District and our staff. Each and every day, they are working to make our students' next day even better. And that's what we do. And so I appreciate our staff, and I'm excited about the new school year. And welcome back. And Kevin, thanks for having us tonight. Sorry about the fire alarm today. I know you got to meet the sixth graders in a different way this afternoon than you thought you would, but appreciate you having us here this evening. And that concludes my comments. And I'd like to introduce Ms. Michelle Weinrob, our Chief Health Officer, to go over some mental health in the school district. Thank you, Ms. Bates.
Oh, thank you. Good evening to President Bates, to the entire board. Before I begin, I really want to say thank you to the board, because everything I'm going to talk about here tonight is because you care about our students. You care about them as whole people, knowing that if we can make them as whole as possible with their families, then they have the best chance to learn, the best chance to find their pathway, their passion. And without that, and without your support for this work, this would be a 5-minute presentation and all my colleagues would be very happy, but it's not, because it's robust thanks to you. So that's really what I want to say before I begin. I'm also very happy to be here to talk about all of the work that our team in student health has done post-COVID, some of it during COVID while we were managing that pandemic and trying to keep schools open, which we did. But this is work that started really in 21-22, carried through from last year, and I'm excited to share what last year looked like a little bit, but also how we're growing for next year. Student health has 2 large departments in it. And I'm only going to touch a little bit on everything that they do. One is our health services, which includes our registered nurses and things more geared toward physical health. And then obviously our mental health department too. And so I'm going to start with our health services department. And I love them both equally. I'm a registered nurse, but I was also a social worker prior to becoming a nurse. So I love both children equally. This is just a little bit about our team that makes up our health services. Our director of health services is here, and some of our other members of the team are here. That team includes 80 in-school registered nurses, highly qualified, Bachelor of Science minimum. Many of them have their masters. Many of them are school nurse certified within the nation. And it also includes our health liaisons. And I'm going to show you a growth slide here in a minute to show you what has happened just in the last not even 10 years. In 2014, we had 65 registered nurses across our schools and 22 health liaisons supporting primarily high school and middle school. By 2018, and I'm very glad that this was the case in 2018 prior to 2020, for obvious reasons, we'd grown to 72 nurses. Our larger high schools have 2 nurses, 2 registered nurses, and we'd grown our health liaisons in large part thanks to our early childhood department, who helped fund that at a time to help us support our preschools and our preschool students the way we wanted to support them, like we do our K through 5 in the elementary. This year, our team welcomed 85 registered nurses across our district with 67 health liaisons, because now there was a health liaison supporting the work of the nurse in every single school in the district, minus one that doesn't have a preschool just due to space issues. So just to show you that growth in 9 years, it's pretty remarkable. Within health services, we also added a health educator in 2020, also a little prescient given what was coming. And then last year, we welcomed a student wellness coordinator who served in another department, and her work now includes helping our resource pantries, which I'll get to in a moment. This slide has a lot of words on it. It's really just to show you how easy it is for us to guide our work toward the 5 core values of the district. And so there are examples in each area and many more that I could have put on there. It could have been 10 slides long, but I'm not going to do that to you. One of my favorite growth mindset opportunities that is not on this slide is what our nursing team is doing this year as it relates to retention of our nurses. And that is they have developed a nurse residency program that really mimics the nurse residency programs you see in big hospital systems and universities. And I think because of that, we're going to see even more retention. We don't lose many registered nurses. It's usually when they move or retire. But this way, we're really building them up to get that mastery in that practice of school nursing in those first 2 or 3 years that they're with us. I know that one of the concerns in the community, and I know that there's been some attention paid as we all start the school year, is related to students being immunized for childhood immunizations that are required by the state. And obviously during the pandemic, there was a downturn in that because access was difficult. You cannot get an immunization through a telehealth appointment. And so our nurses and that team under Jen Ellerbrook have been incredibly mindful to make sure that we're offering multiple opportunities for our families to access that as they catch up. And because they do that work, our overall immunization rate at the end of the 22-23 school year was an astounding 94.41%. That's post-pandemic, unheard of. 95% would be what we would want for herd protection, HERD protection, to help protect others from becoming ill with things like measles, chickenpox, pertussis, which is whooping cough. And so to have that data point as we ended last year is remarkable. We're starting the school year with clinics and with our partnerships with Stride, with 365 Health, our new Arapahoe County Public Health Department. So I'm hopeful that we'll see that number even grow to a better data point by the end of this school year. Please know that this slide could have been busy with maybe 30 graphics of partners that we work with just in the health services realm. These are just a few examples. Obviously, we have relationships with every hospital system. Our foundation, which is integral not just to mental health, but our health services team as well. But I did want to point out that with the opening of our first 2 Stride Community Health Center clinics in February of 22. So we were still really coming out of that Omicron wave. Opened those at Overland Prairie campus and at Horizon Community Middle School. They have seen 4,000 patients in those 2 clinics since they opened in March of 2022. That astounds them, which tells us a lot. 2,592 of those patients were just during the school year. Many of them were not just our students, but their parents, their guardians, their grandparents, their cousins, their neighbors, because it's a community center open to all, and our staff. And so we're just super, super excited that that's going as well as it is. And it's a big lift on our side because our team is really interested in that data. So they work really hard hand in hand with Stride. Coming very soon to Smoky Hill High School. I think we just signed up on the signage for the outside of the building. Will be our 3rd Stride Community Health Center for the district, very obviously centrally located within the district at Smoky. It'll serve Smoky, Laredo, all of the elementary schools that feed into there, and the entire neighborhood community. So we're just super thrilled. One of the points of pride for that new clinic is that we asked Stride if there was a way for them to increase the ability to have 2 full-time behavioral health clinicians inside that clinic for our community. And they said yes immediately, and they're making it so. And so we'll have equal number of appointments for both physical primary care and behavioral health, which is just super exciting for us. A huge part of I think why we are allowed to do as much as we can as a health services team for our students is because we have a medical advisory board, and that board is made up of community members who happen to be pediatric providers, and they give back to us by volunteering to serve on this board. Everyone from hospitalists and surgeons to pediatric acute care providers, nurse practitioners. We have a pharmacist on the team. We have mental health on the team, and they're really amazing. They give their time after long days providing care to come and sit with us and hear about our challenges to help us with our successes. I always say that they're ahead of us in all things. They're always coming and saying, well, have you thought about this? And about 7 years ago, we started having conversations about having Narcan in our trauma bags in schools, and that's the antidote for an opioid overdose. And they were so ahead of the curve that when we did that, and we utilized grant funds to supply those in our trauma bags, trained our nurses to save a life with Narcan. It was about 5 years later that the state caught up and said, hey, that's probably a good idea. All you districts should have policy to that effect. And because we were there with the medical advisory board support, we were ahead of that curve. And now we get it at no cost from the state because Sonia and her team and the board approved that policy. So it just shows you how important they are to our work. This was a number that was staggering to me, and I was a pediatric nurse in our elementary schools at the start of my CCSD career. We saw 180,000 clinic visits in our schools last year alone. So I think that these nurses are needed. They keep our students in school. They keep them from having to go home for either minor injuries or medical interventions that can take place at school. And boy, that number really got to me, and not a lot shocks me. And that's not everything. That's not even some of the expected interventions that they do every day. So 85 nurses, 180,000 clinic visits. You do the math. It's crazy. Part of health services team and our initiative is to make sure that our staff is trained in CPR and first aid. We work very hard to do that. We know that many staff are trained outside the district. If they're involved in other volunteer efforts, if they work for the American Red Cross as a volunteer, all kinds of things, they'll get that certification elsewhere. But our nurses and health liaisons who are trained as instructors under the American Heart Association offered 105 classes last year. We're hopeful to grow that to more classes and more offerings. We'll be excited to train the new staff at Traverse Academy here in the next week or two to get them up and running. And that's just a really important initiative to keep everyone safe in our buildings at all times. I spoke quickly about our wellness coordinator. She's got a lot to do, and part of what she does is she works very closely with our foundation, with Jill Hendon, with Cherry Creek Schools Foundation, and together they do different kinds of grant opportunities for our school staff to apply. It's really fun to see what our staff across the district comes up with in terms of their asks. Sometimes it has to do with regulation activities or alternative seating. Sometimes it's playground equipment so that the kids have new experiences outside. It's really only limited by our educators' imagination, and they all have great imagination. So we really enjoy being able to grant, along with the foundation, some of these initiatives. And as I mentioned before, one of our wellness coordinators' big buckets starting last year and moving forward is to really work very closely with our schools who offer resource pantries for our students and communities. This is truly I put equity and relationships on that slide. I think, as you know, that's a growth mindset to expand that and look at that differently. And it certainly builds that whole well-being that we need, because we know that kids who are hungry do not learn well. And so this work is so important. We have partners with Secord Cares. We have other partners in the community that help us. But honestly, our greatest partners are our community, because last year we started, we thought we would see what would happen if we offered each feeder the opportunity to do its own drive and then stock our pantries. And the response was so overwhelming that we had to figure out how to get more containers at most of these schools, because people are so generous. And people are generous across the district. And I want to be very clear that it isn't just the schools where you think they don't have a need. And by the way, there is no such thing. So please dispel yourself of that fallacy. But every school participated, every feeder participated. Our board members came out to support the work. Our staff came out to support the work. This month right now, our district administration buildings across the district have been conducting a snack food drive to replenish snack pantries in schools. And again, the response has been so overwhelming that our own staff are having a hard time just keeping up with picking up the items. So I'm real excited to start next month. We'll do 3 this semester across feeders and then 3 again in the spring semester. And it's really, it's a wonderful way to give back. So that's a little bit about that donation drive I just talked about. And now I'll move on to our mental health team. They are an incredible group of humans. I think anyone knows, if you know someone in your life who works as a mental health provider or clinician, they are some of the kindest, most grounded, calming people you'll ever get to spend time with. And we are very, very fortunate to have an incredible leadership team. You can see that we have a social emotional learning coordinator. I'll talk about that in a minute. We have a new crisis prevention and response coordinator who will work with our director, Steve Naderveld, in that work. Our McKinney-Vento team, who supports our unhoused and transitional housing families, fall under this department and are doing amazing work. We have 175 school social workers and school psychologists across the district. We definitely exceed any state model of what is prescribed in terms of how many staff are in our schools. And we know we have larger schools, and so we should. And so I'm just so proud of that. And again, that is in such large part thanks to the work of this board, of our leadership team, of Scott Smith's team, helping us to find a way to how to staff this more appropriately. For our students. We know that our families and community have said mental health is very, very important. And so we listened, and this is really the proof of that. Super excited to say we have 11 interns this year who are post-grad after their master's studying to become social workers and school psychologists. They want to come here because they want to work here. And I wish I knew the number off the top of my head, but I know of at least one very excited intern who has now come up to me and to Chris and to others at several functions as she wended her way through the interview process to become a full-time staff member. And she is now one of our staff members at one of our elementary schools. And she was at New Educators Orientation, and her smile lit up the whole school. She was so excited to be there. So it shows you how we can grow our own in terms of cultivating students all the way from CCIC all the way through to when they're interns, and then bring them onto our staff. We brought in 38 newly hired staff, including our clinicians for Traverse this year, and 18 of those are new additions to the district. So that shows you your commitment, this district's commitment to saying, yeah, we know this is important, so we're going to beef this up. Again, this is an example of just showing how easy it is for us to place our work into the 5 core values. Mental health, this team I get to work with, I can tell they're always mindful about this, and they're always thinking about what is best for kids. How is it going to be seen through an equity lens? Is it a growth mindset? And how are we building the right relationships inside and outside the district to meet these kids' needs? And so I'm super proud. These are some of the mental health team's big bucket goals for the year. I'm going to talk a little bit more about the screener, the social emotional learning screener in a minute, but we're moving that from what was an 8-school pilot last year to 32 of our schools this year, with the goal of expanding district-wide in 24-25. They work very closely with our special education department for students who have IEPs, accommodations under 504. They're working, as Ms. Egan so beautifully described, that working to provide referral services so that our students have access, because there is nothing more frustrating for a family than to know that your child needs help and you cannot access it because there are wait lists, or because your insurance is not accepted, or you don't have insurance, or you can't get there because you're working. And so what this team has done as it relates to the partnership with Hazel Health, which I'll speak about more in a second, Stride, our clinicians who are in many of our schools from All Health and Aurora Mental Health and Recovery, they're just really mindful of making sure our students have access, and it's pretty great to see. The other big piece that is always on our mind, of course, is psychological safety. We work very closely with Jason Koenig and Ian Lopez's team to try to, really make sure that we're being as preventative as we can with our students. We're working really hard to make sure that we apply evidence in the work that we do related to suicide risk and threat assessments. And in fact, this summer, our team did the big lift of saying it's time for us to meet that evidence-based work. And so we're upgrading our suicide risk reviews, we're upgrading our threat assessments, even how we document them electronically. And so obviously that takes a huge collaboration across the district. It's not just our team, but it's going to be what's best for our students. And so they're going to do that. This is just a little snapshot from the pilot last year that I just spoke of, the 8 schools that participated. And thank you, Liberty. We're here at one of the pilot schools. So thank you, Kevin, and to the Liberty team for saying yes to being one of the pilot middle schools. Panorama Education is the company we're working with to provide this screener, and it's not a mental health screener. It's important to understand this is a social emotional screener that asks kids questions about belonging and relationships and resilience, and being happy and sad, but it's not a clinical tool. One of the things Panorama shared with us after the pilot was that they'd never seen response rates like this. Now, I know we are special and we do lead the way, as Chris often reminds us, but this also really just shows us that families want us doing this work, because they could opt out and they had their kids participate because they want to know how they're doing. Again, this is just a little snapshot of some of the initial data in that pilot year. It will look different, I think, this year. It will look different certainly when we're asking all of our students, K-12. But you can see, there were two that, of course, the higher number and the lower number stick out in your mind when you're looking at data like this. And I think it's interesting that supportive relationships, and that could be inside or outside of school, students rated that very highly. But then if you look at the bottom, that sense of belonging was lower as they entered middle school and high school. Not low, but lower. And I think that that's some work we're going to want to delve into to see what the why is to that data and all the data, frankly. But I think this is just going to guide our work. It will guide our mental health staff work. It will guide our administrators and our educators. And I think it might guide what we do next. And so I think that having the opportunity to offer this screener to kids and really ask them how they're doing will really help us in the future. Hearts is an amazing program, and our team does a lot of work as it relates to grants and grant writing, and we work with the grant team here in the district to really try to recognize what are our best opportunities to affect kids. And I think everyone knows a child in their lives who's had trauma. And it doesn't have to be like terrible trauma. Trauma can be being a child of divorce. Trauma can be that your parent was a first responder during COVID. And so our team has recognized for years, frankly, that trying to provide certain kinds of social emotional learning for students who have had trauma, whether it's racial trauma, whether it's trauma that, has to do with a loss of a family member. I think this work just really speaks to how we can get the kids to a point where we want them to be so that they are available to learn. So these are the schools that have participated in the Hearts Trauma Informed grant work. Most recently, they had an amazing year-end celebration at Polton Community School this last year. I still hear people talking about it. Someone in a meeting I was in today mentioned it, and I thought, wow, that was really impactful because that was about 6 months ago. So we're really pleased that this work will continue. We're nearing the middle end of a grant cycle, and so we will pursue this in the future. The feedback we get from administrators at schools that participate in that shows us that that work is worth it, and it's worth trying for the money and then staffing the actual program. These are just some of the points of pride that in terms of what are addressed in that curriculum. And it even gets down to working with adults because we know that caregivers need to be well to take care of their kids. And so it's just a really meaningful piece. I did mention that in mental health, we do support our McKinney-Vento team who support our students who are either unhoused or in transitional housing. You know, this includes students from all walks, and it includes students who are refugees, who are new immigrants, who are Colorado natives, and everyone in between. And this team is an amazing small group of 3 women. They're supported by Jay McQueen, our assistant director for mental health, and they will do anything to make sure that these kids can get to school, can access their education, and that they can do it with dignity. And I'm just proud to get to work alongside them and do anything I can to support their work. Unfortunately, we have seen tremendous growth in our numbers of unhoused families and students. Last year at this time, we were probably at about 580 families. At the end of this last school year, as we started, planning about 2 weeks ago, we were at 1,000 families. So that shows you that what's happening out there is real, and we have work to do. One of the great things that the director of mental health, Steve Naderveld, and I have gotten to do is really spend some time with students. And Chris and Mike Giles and now LaToya Tolbert have allowed us to really spend some time with the Superintendent's Advisory Council of Students. And I think we've learned some of our best lessons about what we want to do, what we don't want to do, where we want to spend more energies, and really hearing their truth. And it's been incredibly fortunate for us to get to sit with these high school students. We're looking forward to continuing that because, again, they really share with us for real. And when they do, then we can take that and take that back. We adults can sit in a room and talk all day long, but we need to hear from the people we're serving. And the last time I checked, they were students. So I'm looking forward to more of that work. But you can see some of the points that they brought up to us. And we're working on all of these because we believe that they are right. Ms. Egan mentioned Hazel Health. We're just so grateful for your support, the financial support that allows us to offer these telehealth mental health appointments to our students. Last year, we launched in about a week before finals in December of 2022. And so we only have had them for a semester. It was open for grades 6 through 12 last semester. The service they provided, the feedback we got from parents and guardians, the feedback we got from students who had this access was such that we determined that we would expand this to all of our students, kindergarten through 12th grade. And so that is another big lift this team has done over the summer, is readying all of our schools for that. There's a lot of training that goes into that. Even though they're not supplying the actual mental health care, there's a lot of work to work with families and with the providers on the Hazel end. And so I'm grateful to the team for saying yes when it was one more thing we were asking them to do. This shows you just from January to May of last year, the total number of referrals in just those 5 months. we had the opportunity to have, I think, 21 schools with middle school and high school, and 20 of them had at least one referral. That was from school. Most of our referrals actually came from parents and guardians, and that was a surprise to Hazel. Then at least I want to say in May, there was about 70% of those referrals were made by parents and guardians, not our staff. And it's not that our staff didn't want to, it's that the parents and guardians were beating us to it. And so again, it just shows you, what our families, we believe, are looking for. And so those are some data points from last semester. I'm going to be very excited to share with you updated data as we look at this 23-24 school year when it's open to all students. We also have clinicians in our schools from Aurora Mental Health and Recovery. These are the schools that they are serving in addition to our school social workers and psychologists. They can see students on a more private basis. It's not a regular weekly session, and it's not a long-term commitment, but it's a time for when a student is just needing some short-term mental health support, and we're grateful for that has grown. You can see that there are many elementary schools, and so that's really helpful. And then All Health and Recovery is also one of our in-school partners, and they've also grown. And they serve more middle schools and high schools, including this middle school, and we're also grateful for that relationship. So this is really just a little bit of a snapshot of the growth that I mentioned before in terms of our staffing, and a special thanks to the Cherry Creek Schools Foundation, because as we came out of the pandemic, started coming out of the pandemic, Jill and her board really recognized immediately that this would be a concrete way, their help financially would be a concrete way for us to serve kids as we assessed what they would need coming out of the pandemic. And they created a mental health relief fund for families who qualify financially so that when they do access mental health care outside of the district, they can do it without fear of how they're going to pay. And so that work has continued. Truly, now we're entering our third year with that work, and it's obviously very important to many of our families. That's my presentation. I'm happy to take any questions.
Thank you, Ms. Ryan Robb. We're fortunate to live in a district that believes in having nurses in every school and more than one nurse in every school. I still remember the days when my children were very young and the school secretary would hand them a frozen sponge in a Ziploc bag for their whatever owie they had at the time. So I remember that well, that there were not nurses and they traveled from one school to the other. So I am appreciative that we live in a district that supports and believes in making sure our kids are taken care of, and our staff as well. So I will have Ms. McDonald start with questions if she has questions this evening.
Thank you, Mrs. Weinrob, for a wonderful report, very thorough. And I am one of those that participated in that spring celebration at Polton. And yes, I'm still talking about it too. It was very impactful. What has been your most dominant challenge with the mental health programs? I know at one time we were talking about ease of access for students and being able to realize that they could, contact someone.
Yeah, I think that certainly access across the board, and I think anybody who's tried to make any kind of doctor's appointment, provider's appointment, whether it's for physical health or mental health, can see that challenge, especially just as Colorado grows, but maybe that provider network does not. So I think that access has been a challenge. I think for us, the biggest part was really assessing what our students needed, what our families wanted for our students. I think that when Chris convened our mental health task force back in January of 21, because we knew this would be a multi-year trauma coming out of COVID, and that we needed to look at things differently. And it's almost as if COVID gave us an excuse to do that because it was real and that trauma was real. But we also knew that the mental health needs of our students were increasing before COVID. And so I think that gave us the opportunity to listen, to bring community partners to the table, to bring students and parents and staff to the table. And because I think our team was willing to implement a lot of the recommendations, that allayed some of those unknown challenges. I will tell you that our greatest challenge, my greatest fear and challenge, is not knowing when a student is struggling. And so I think our greatest goal is to know our students so well that we will know when they're struggling.
I think I probably worded the question wrong.
Or no, you probably worded it great and I didn't understand.
No. What I was referring to is help within the school, that a student will know that services are available within the school, and that hadn't been so prevalent where students would know that they could access.
I think because we have more staff than we did, I think that there's some knowledge there from our students, but we worked really hard with Abby's team and they created these amazing posters. I mean, they're incredible. And I was just in a restroom at one of our schools and I saw it and I was like, oh yeah. Mm-hmm. And it has a QR code on it and all the kids have to do, and I know elementary, most of them, I hope most of them don't have phones, but the kids in middle school and high school, they can click on that QR code and they can see the names of their providers in the school, their counselors, the mental health providers, their nurses. They can even see their room numbers. So if they're a 9th grader or a 6th grader and they're just trying to figure out their schedule, they can say, oh, I know where that clinic is, or I know. And honestly, we have a lot of students ask the nurse because the clinic is usually visible. And they can ask the nurse for, where is the mental health team? But those posters went a long way to helping that inside our schools.
Well, yes, that's exactly what I was talking about.
I got there.
But I also just want to say and commend the nurses, because not only do they take care of students, but they take care of staff. So thank you.
They have a hard time saying, I can't take care of you.
So that's all I have.
Thank you, Director McDonald. Director Allen?
Thank you for your presentation and also for the presentations that you give us throughout the year so that when we get to this incredible thing that you're doing right now, we have such a great background to know what's going on. I've told you this so many times before, but my mom was a school nurse for 20 years. And every single time I talk to her, I get to brag about something our district is doing because your entire team. And she kept saying, where were you 20 years ago? So thank you. It touches my heart and my head. And thank you for all you're doing. I don't have any questions.
Thank you. Director Egan?
Thank you, Ms. Weinraub. That was very informative, and we always appreciate hearing from you. I wondered if you could talk a little bit more about what's going on with immunization rates right now, and then how you see that cycle through the school year.
Yeah, I think, I do believe that families are in catch-up mode. And I think even the most well-intended families that have always been up to date on immunizations are maybe finding themselves a little behind. And I think it's our job to help and really guide them, because I do think sometimes you just feel stuck. And when you feel stuck, it's hard to keep moving forward. And so I think, our nurses do, I know they do it because I've seen them. They do an amazing job of sitting with families, explaining the process, explaining what is required by the state as it relates to those required immunizations, what are recommended, so examples of required would be that measles, that chickenpox. Recommended would be the COVID-19, not required, just recommended. Influenza, that yearly influenza shot. And so I think, when you combine that person-to-person contact that we want our nurses to have with families and students related to that, and then the offerings out of Jen's team in terms of health outreach for those clinics, I think it's our job just to market that really well and just to remind everybody, you were doing this before COVID. Let us help you do it after COVID.
Great. Thank you. I appreciate that. I did have a question about the donation drives coming up. As you know, I did altitude last year, and it was an amazing experience. But you covered that, so thank you. And we'll look forward to 6 of those this year. Such filling a great need, and the snack drive too. So I know that the Medical Advisory Board has different programs that they work with the district on. I'm just wondering if you could address concussion protocol and what's going on with that in the district.
Yeah, you bet. We're fortunate that I should have said we have 25 providers on that team. We have about 20 staff members on that team too. And because we don't want to work isolated, we want to collaborate. Sonia sits on that team. Larry Bull from Athletics and Activities sits on that team. It's so critical so that we can have these broad-based conversations. And in fact, both Jen Ellerbrook and I sit on a committee with Larry on Larry's side of the house that works with our athletic trainers, and that happens to be through CU Health at this time. And so we really want to stay up on the evidence, and concussion evidence and protocols change. And there are certain things that don't change. Math doesn't change. This work changes, and how we look at the kids and how we send them for diagnosis, because we don't do that, but how we send them for diagnosis, how they're monitored during their post-concussion time, and then how they're returned, whether it's to sports in the schools, club sports, activities, academics. Doesn't matter what the reason is. We need to look at them that way very carefully so that we do the right things by them. And Larry has recently brought, through our medical advisory board and Dr. Boblick at CU Health, a new protocol that they're piloting in 3 of our high schools. And we're working with both genders and different sports. So we're looking at 1 school for football, 1 school for cheerleading, and 1 school for soccer. And if this protocol works like we think it's going to as it relates to how the athletic trainers assess and send off to providers, I think it's going to be something we're going to recommend going wide with, because I think it's probably the next good thing for that. And again, because providers are hard to get outside of the district, we have to make this easier for families so that they will pursue that care post concussion and not just do nothing, because that's often not the right thing to do.
Thank you. I appreciate that. And just as that's all of my questions, but I would also just like to say Cherry Creek School District is, and this is no small part of what we do here. And so I just need to thank you and your team for everything that you do and just focusing on all of our students and our staff. It's critical, and we've really followed through on that commitment. So thank you.
It's our honor. Thank you.
Thank you, Director Egan. Director Garland, do you have questions this evening?
Yes, thank you, Mrs. Bates. For those of you who haven't heard my story, I have Fortune 500 insurance. My daughter was having a problem with her vision. Went to multiple doctors, her primary care specialist, world-renowned specialist. It was Nurse Patty at the school who diagnosed my daughter, Nurse Patty. Nurse Patty is now retired, but I took Nurse Patty's information from the vision screening and took it to the specialist and said, Nurse Patty said, this is what condition that she has. So never underestimate the value of school nurses. I know we are one of the few districts, if not in the area, that has full-time nurses all the time. And even as my children have had broken bones and all those sorts of things, school nurses have been integral to how they are able to live out their school day. So I appreciate that. My question is, getting to my question, but as we've had more nurses in the schools, are we tracking the graduation rates of students that have chronic conditions?
That's such a great question. I don't know that we're tracking it inside our team. I know that we can get that data.
Okay.
I can tell you that watching the increase of nurses and the increase of the kind of care that nurses are giving, we have seen that for sure in the last 10, 12 years, because the families and the providers that care for those students outside the school trust our nurses to care for them during the day. because that's a big trust. When there weren't nurses, or if there aren't nurses in schools, the parents would come and care for their children, right? And then they have a hard time working outside the home. They have a hard time caring for their other children, all those pieces. But because they trust our nurses, I know that attendance rates are better because we send so fewer students go home in the middle of the day for things where they would absolutely have to go home for because they don't need to. If it's contagious, if they're injured and they need to be assessed immediately, of course they're going to go. But for so many other interventions, they're expected and they don't need to go. And so if you take that track from just knowing attendance is better, one would hope and posit that graduation rates would be better. But that's something we can look at and get to you.
Thank you. And then also kind of piggybacking on Director Egan's question about the concussion protocols. Are we looking at like the intense sports for kids and measuring how they, I guess, some of their like growth and development? I guess I'll just ask my question. I have a book that I'm going to read about. She was at one point in time the fastest girl in the nation, but because she's such a high level athlete, her menstrual cycle had changed, and then now she has a lot of problems with broken bones. And so I know as a lot of our kids experience those things in school as far as broken bones, concussions. Is that part of what, do we monitor any of that stuff?
We don't monitor the overall health and wellness of students as it relates to that in terms of athletes. I think that we do see our student athletes as whole people. And when, because we document and chart, just like you would in a hospital setting or in a doctor's office, a provider's office, we can see a whole medical picture of a student, and that information belongs to the family. And so because that information belongs to the family, they can access it and see trends. And, as it relates to concussions, we're always worried about that second assault, that second injury. And so because we document when a family shares with us that a student suffered a concussion or they did it at school, we can chart on that and then trace that. And we do that with actually using a special icon in PowerSchool in our database, so that we can be very careful to track that. The same is true for other injuries. If we start seeing students with patterns of injuries or illnesses, that's when we're going to go right to that parent and guardian and say, hey, we're seeing the same headache, and it's not because they don't want to go to writing. We are seeing a true clinical headache or a true clinical, knee pain over and over again. And because we chart that way and because we build those relationships with families, then we can share that. They can take that to their child's provider. Again, if they don't have a provider, we'll work with them to help them find one. And that way they can work with their provider to track that. Because, those kids get hurt.
Thank you. Well, I could say my family appreciates having the school nurses. And again, it's been a tremendous help and helping for them to be able to have a great educational experience and being able to, be able to be in school more oftentimes than not. Thank you.
All right, thank you. I have a couple follow-up questions for you. We had approximately 1,000 families who are McKinney-Vento families. Do you know how many of our students are on their own? No parents, they're just on their own. Do we have a number of that? Or
if we are ever made aware of that situation and they're not emancipated or over 18, we have a threshold that we meet with the county. That doesn't have anything to do with being unhoused. We would do that for any student.
Okay. And then, so could you just speak to when our students need to be seen at any clinic for whatever, but if they're going to go to one of our Stride clinics or if they're going to contact Hazel Health, can you speak to the parent involvement in that and what ages they need to be? I know people have questions about,
Sure.
So if you could speak to that.
Oh, of course. Yeah. So in all things like that, we follow Colorado statute. Okay. So we will always follow Colorado law. So, I'll say that. And then I will also say that because relationships with our families, not just our students, but our families are so critical, that our team, whether they're nurses, health liaisons, school social workers, school psychologists, they will move mountains to build that relationship with the entire family because it's their child. right? And one of the things that I learned as a school nurse was to always remind myself in the middle of whatever I was doing clinically that no one knows a child better than their family. Okay. I can think I see them and I can read the charting and I can do all those pieces, but no one knows them better than their own family. So it's our job to work with the family whenever possible. Okay. But other than that, we follow Colorado statute, and that would not just be for Stride or with Hazel, but with any provider.
And Colorado statute is 12 or 13. I mean, when you can see a provider by yourself is 12 or 13.
So for mental health, Colorado statute currently states that students 12 years and older are allowed to access that on their own. Again, we work with our families. We want them to be involved. 12 is 12.
Oh, I understand. I know. I mean, when we go see our own, your PCP, they take your child in and they speak, which I'm thankful for, because our child may not tell us what is really going on. So I'm thankful for that children can see a medical provider without us going in with them always, and then have the medical provider speak to us as well. So I'm thankful for that. So thank you. I believe that is the end of my questions. So thank you again for a great presentation. And I too am thankful. My children have used the nurses many times as well for all kinds of different things. So it's been good. So thank you. At this time, it is time for, members of our audience for comment. Sorry. It is at this point in our meeting that we make time for members of the audience who have completed the online public comment form prior to 12 noon today to address the Board of Education. For everyone to be heard, please limit your comments to the maximum of 2 minutes. A buzzer will sound at the end of the 2 minutes, and the microphone and audio will be automatically muted. Each speaker may only speak once during public comment. Speaking time may only be shared between be shared between speakers. This is your opportunity to make comments to the Board of Education in accordance with board policy. It is not a question and answer session. Please confine your comments to matters that are germane to the business of the district. Further, please recognize that students attend most of our meetings. Any speaker whose statements or behavior are unrelated to the business of the district, appear threatening or unsafe, or are inappropriate for K-12 students may be interrupted or warned, and their opportunity for comment terminated. Audience members who speak are asked to do so in a respectful manner, and the audience is encouraged to listen respectfully. Any speaker or audience member who disrupts the good order of the board meeting, including the speaking time of others, may be asked to leave. We are very interested in your feedback and will listen carefully. On behalf of the board, I want to thank you in advance of your comments for taking the time to come to tonight's meeting. Mr. Koenig, would you please invite the first group of speakers to line up?
As I call your name, please line up behind the podium and remember to state your name at the beginning. Casey Ellis, Rima Wadon, Lori Gimmelstein. Casey, hold on one second. There we go. Thanks.
Parent and the president of the Cherry Creek Education Association is going to come up and talk about our salary schedule, but I thought I'd share with you what's been going on with my two boys. My two boys, I have a senior at Smoky Hill and I have an 8th grader at Horizon Middle School. And both start school tomorrow. And we've done all the school supply shopping, gotten the new clothes for their fit. That's the new thing, right? But the one thing both of them could not wait for was their schedules. They couldn't wait to find out who their teachers were. Couldn't wait to see who was going to be teaching them science, math, language arts, social studies. And that was the big thing. Who are my teachers going to be? Well, my 8th grader loves his band teacher, Mr. Geiger. And Mr. Geiger knows that kiddo well enough that he can tell what kind of mood he is in when he walks into his band room. Sometimes it's a great mood, and sometimes it's not a great mood. I've taught middle school. I understand middle school kids and the moods that they can come in a classroom for. And Mr. Geiger and I have had a conversation about what he does when my kiddo walks in and he's not in a great mood. And sometimes it is not playing his bass clarinet that day until he's in a space where he can. My senior has a few favorites, but his very favorite was his very first science teacher when he was a freshman, and that is Brett Spidell. And he will always go and see Brett. And oftentimes I have to tell him that is Mr. Spidell's plan period. Please don't bother him anymore because he needs to plan for his next class period. My point is, what I got from my boys is how excited they are to start their school year, not because they're going to see their friends, but because they're going to see their favorite teachers. Thank you.
Good afternoon. My name is Rima. I'm a parent and alum in the district. I just come today to address an area of an improvement for our district. During last spring, there's horrific acts at my daughter's middle school that led to acts of anti-Semitism in our district. And our district provided a meeting and subsequent mandatory training for our teachers, faculty, and within the district. While I applaud this training, I fully believe that this training should have been expanded to encompass other forms, other groups that have been targets of racism and/or bullying in our district. Why should we limit the training to just one identity when we can clearly be more thorough and intentional in our training here at Cherry Creek School District? I say this because our past group holds a yearly panel with young students, and in those meetings, these are exceptional students that come vulnerable and they talk about things that clearly affect their personal identities and have impacted their social emotional well-being. One amazing student who actually spoke at this Board of Education meeting, a student of color, described that many times students would ask him for the NPAS. And if you don't know what that is, please look at it because it's very deplorable. He's not the only one within the district that has had this incident happen. Many others have. Other student, female, Latina, also suggested that deans be representative of both female, male identities and hopefully a person of color to be representative of the student voice. Those are just two suggestions that came out from our past group. But there's a multi-spectrum of racism that our students are affected by. There's an opportunity for our faculty and staff to grow and learn and identify the many forms of racism. And I hope that you guys can provide our teachers with not just anti-Semitism training, but training that will combat homophobia, disability discrimination, Islamophobia, and other forms of xenophobia in our district. I look forward to continuing this discussion because our children deserve nothing less. Thanks.
Hi, my name is Lori Gimmelstein. Good to see you all. It is our 2-year anniversary of my attendance to Board of Education meetings. And I'm here tonight just simply to put forward some requests. We have a district with more than half of our students not meeting grade level standards in English language arts and math. That number is 59.9% in 2022 for students in math, not meeting grade level expectations. It is imperative that all of you that have been on this board for 4 to 8 years are held accountable to the people that elected you to serve us. So I'm requesting a public town hall style meeting where parents are allowed to ask the board questions about plummeting academics in the district, about the serious safety issues, drug issues, weapons being brought to school without parents being notified that it's happening, sexual and physical assault and harassment happening in the district, violation of Title IX, controversial curriculum, high turnover in special education, and why hundreds of families are leaving the district. I'm also requesting again, as has been requested multiple times by multiple people at multiple Board of Education meetings, to please ensure that everybody has equal access to the Board of Education meetings by offering a live stream of all Board of Education meetings. I believe Cherry Creek is the only district in 178 school districts that does not offer a live stream, and we know that it is possible. Thank you for your time this evening, and I look forward to hearing from you about offering a town hall to the community that elected you to serve them.
President Bates, that's all for tonight.
All right, thank you. Again, I'll thank you all. Thank you to our speakers. While this is not a question and answer session, we have listened and we make notes of all of your comments. So before we move on to consideration of the resolutions, are there any resolutions that board members would like to pull or discuss? Right, thank you. Since there is no discussion, may I have a motion to approve the consent agenda 23.8.1 through 23.8.15.
I move to approve the consent agenda resolutions 23.8.1 through 23.8.15.
Thank you. Is there a second? Any discussion? Thank you. May I have the roll call?
Directors Allen.
Aye.
Bates.
Aye.
Egan. Garland. McDonald.
Aye.
Thank you. The motion to approve the consent agenda carries. The only other information remaining business is to announce our next regular Board of Education meeting, which will be Monday, September 11th of 2023 at 7 p.m. at Infinity Middle School, 25,100 East Bellevue Avenue in Aurora, Colorado. Thank you again for attending tonight's meetings. Please keep yourselves and your loved ones safe. And remember, the best way to be informed with actual facts is to attend meetings here and at your school. May I have a motion to adjourn tonight's meeting?
Move to adjourn.
Is there a second? Thank you. Is there any discussion? Roll call, please.
Directors Allen.
Aye.
Bates.
Aye.
Egan. Garland. McDonald.
Aye.
Thank you. That motion passes and this meeting is adjourned.